Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Hello and welcome to Your World Today, a show that encompasses all your health needs, financial needs, exercise, cooking. My name is Ofelia de la Torre.
And I am Kerrigan Von Pulley, and we're very excited to have you with us today.
That's right. We have our first guest. She is a doctor at White Memorial Medical Center. Her name is Dr. Kozue Shimabukuro. She is the director of pediatrics ICU at White Memorial. Thank you for being here. Such an important person.
No, pleasure to be here. Thank you.
Doctor, I want to talk a little bit about whooping cough, which is something that's become more prevalent in this day and age. And maybe you can tell us a little bit about what it is.
Yes, the whooping cough, actually, as you said, there has been an outbreak in the last couple of years nationwide and especially in California. So the whooping cough is something that's caused by a bacteria called Bordetella pertussis. And the CDC and the California Public Health reports that last year or so, there has been a 30% increase of the cases in the pediatric population. This is something that we've been watching out for in the pretty serious cases.
Doctor, how common is whooping cough and who is at highest risk?
So the whooping cough used to be not so common because of the vaccination. So since the 40s to the 80s, we thought that, we have eradicated pertussis, which is the same thing as whooping cough, and that we were celebrating that success. But since the 80s, now it's becoming to be more common. In fact, in California, there was more than 17,000 cases that was reported already in the 2014 up to August, so which is a significant increase.
Doctor, is that because people stopped vaccinations?
We suspect so, we do. And who is at most common risk is the pediatric patients. Most of the patients who are diagnosed with whooping cough is less than 1 year old. Yeah, little
babies,
tiny babies.
sure.
Yeah.
So what, as a parent or a caretaker, what are we looking for as symptoms of whooping cough rather than just saying maybe it's the common cold or something?
Right, that's a good question because whooping cough exactly starts as common cold. They initially starts out with runny nose and a tiny cough, and they think that the kid has just a regular common cold, but then it progresses into something more serious. And then there is something called paroxysmal cough, and that's what the doctors use. And but amongst the parents, it's actually known as a coughing attack. Right. And that's what you should be looking for. What it is, the coughing attack, just like the name sounds like, there's a period of cough. They cough, 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 and they inhale, and it makes that weird noise, and cough, 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 and then for 5 minutes. And then during those paroxysmal time, the patient, baby can have stop breathing, and then they could have turn blue, and then don't have enough oxygenation, so it could lead to death actually even.
Is that a very dry cough, doctor?
Yeah, it's a dry cough, dry sounding cough. It's very persistent for a long time, followed by inhaling sounds.
So you just said it's life-threatening, doctor. How severe is it and how prevalent in order for it to be life-threatening?
Okay, so it really depends on how severe is it. It depends on the patient. Younger they tend to be a lot sicker. So just looking at in California data, more than 24% of the patients who were less than 1 year old who got diagnosed with whooping cough was in fact in the pediatric ICU. So almost 1/3 of the patients less than 1 year old with a whooping cough ended up in the ICU. So that's how bad it is.
It sounds like it's a very scary thing, and I'm sure scary for any parent or anyone with a child. What are some of the long-term effects besides obviously being life-threatening, which is the worst, but what are some of the other long-term effects of whooping cough?
Okay, good question. So the whooping cough itself is long-lasting. I don't know, a lot of people know that or not. In Japan, where I come from, it's called 100 days cough. So it lasts for several weeks to several months, and at that time that your child is being at risk for coughing and not getting enough oxygen, so that itself is a risk. And then after you recover it, thankfully there's no residual effect and no neurological, like no sequelae from that. But that said, because the severe cases of the whooping cough can lead to seizure, and then also stop breathing.
That's if left untreated.
If it's left untreated. Even with the treatment, sometimes if you have catch a severe whooping cough, and then it's difficult to treat, so.
Can it be prevented, doctor?
It can be. That's the part that we are trying to promote with the pediatrics department, because, as you know, there is a vaccination out there for whooping cough, which is called DTaP for the babies, and for the adolescents, it's Tdap. So there's two types of vaccination that you can give to your children.
When is it crucial to vaccinate?
So during the infancy, first 1 year of life, so that you can go to the pediatrician, and then they can give you typically 2 for 6 months, and then you have to get a booster shot, because the vaccination only lasts for 6-7 years. And then they get a booster shot, and throughout your life, in fact, you get to be protected. And pregnant women too, now that American Association of OB-GYN doctors are now recommending that if you are pregnant and in the 3rd trimester, then you should get vaccinated with the whooping cough vaccine.
Have you been vaccinated, doctor?
Next week.
We want to congratulate Dr. Kozue because she's pregnant also. So
right.
That's a very, very important time of your life.
That's in my checklist, to get the whooping cough vaccine, because I want to protect my infant.
Of course, you do anything to protect your child.
One more question that I know is really on a lot of people's minds, and we've seen it in the news, is are there any risks involved with the vaccine itself? Because I know a lot of people, you hear different sides of the argument.
Right. See, I think since the 80s, we kept hearing from the media, so could vaccination cause some kind of life-threatening side effect? And so the CDC and the American Academy of Pediatrics took the consumers' concern seriously, and they've done quite a bit of studies. And in fact, there's a couple websites you can go to. One is called VAER, a Vaccination Associated Risk Reporting website, and then the CISD, I think, and then the couple other ones. And so if you go to the CDC-sponsored website, and you can see that clearly vaccinations with whooping cough was not associated with any risk at all. So, there was rumor out there for several decades, I think, but now we're starting to come around now. The evidence shows that it is safe. And as an ICU doctor who receives all these sick patients because of the whooping cough, and I would rather protect my baby with vaccinations, who is very minimum risk, and compared to what could happen to my baby.
So imagine you cannot stress it enough, that the importance of vaccinations. Absolutely.
Yeah.
Well, doctor, we're going to continue talking about all these important topics after the break. We're going to go and come back. But we're also going to be talking about our financial health with some of our experts. So don't go anywhere.
This segment was brought to you by White Memorial Medical Center.